So thank you all for joining us today. And at this time, I'm going to invite Dr. Shashi Gujar to begin our panel discussion. Shashi, please tell us a bit about your research and what impacts it will have on health outcomes for people locally and for all over the world.
Thank you, Janet. Can you guys hear me clear? Okay, good. How was lunch? Good, good, that's it. So thank you, Brian and Janet, for introduction as well as laying down the foundation for the talk that hopefully we'll have in here. And like Janet mentioned, I am an immunologist, and I work on training your own immune system so that it can fight cancer on its own. So imagine the future wherein you don't have to rely on taking drugs to treat cancers. And to do this, believe it or not, we use viruses. Viruses that infect you, get you sick. So let me just ask a simple question. In last 6 months, year, how many of you got some kind of infection? Within a year, within 2 years, 3 years, 4 years, right? Okay, so you remember that feeling, runny nose, headaches, chills. Did you enjoy it? Not really. So, most of the times when we think about these infections, we don't really think really good things. It's always associated with some type of disease condition. But today, I'm going to tell you a story, maybe that will change your perspective on how these pathogens can be used as modern day medicines. Okay? So, just like every story should start, once upon a time, not so in a distant past, there was a surgeon named William Coley, and it is a true story about how modern medicines around these pathogens came about. So William Coley was a recent graduate, and just like every other recent graduate, very enthusiastic, very passionate about his medical practice, and he thought that he could cure cancer patients by just doing the surgeries. But as soon as he started his practice, he soon realized that he could amputate the part that had cancer on it, but that patient would still die from cancer. And we are talking about late 18th century or the beginning of the 20th century. So you're talking about 100 years ago, 120 years ago. So of course he was disappointed, disheartened, and he said there has to be something more for this cancer treatment. So you can imagine back then cancer was almost a death sentence. If you had it, we only had so many different options to really treat it. So being a surgeon, there was no other facility. So he went on to become his own cancer researcher, just like what I do. Right? And what he figured out right away within first few years of his discovery is that if he had a patient, if he did a surgery on that patient, and if that wound got infected, that patient did well. And to his astonishment, what he did, he prepared a soup of bacteria and intentionally injected in cancers. And guess what? He could cure patients by just doing that. But you have to remember, this is 100 years ago when there was no antibiotic. So you can imagine, you're playing with fire. You're giving patient bacteria. There is no way you can control it. And those were the reasons that, and at that time we also didn't understand our body really well. We didn't know how everything worked in our body and everything. So some of his patients, they died during that treatment. And of course, he was shut down. So this otherwise amazing line of discovery, which could have given us new cancer therapeutics. Back then, it was shut down almost 100 years ago, 120 years ago. Now, fast forward 120 years. In 2015, 3 years ago, Food and Drug, the FDA, Food and Drug Administration from states, they approved the first live infectious virus to be used as a cancer medicine for treatment of melanoma. So this is now reality. We know that these pathogens, these viruses, these bacteria can be used as modern medicines. And in our lab, we have now figured out how these medicines work. We know that these viruses, what we call them the oncolytic viruses, cancer-killing viruses, oncolytic, these viruses can kill cancers by two different methods. One, they are able to kill cancers on their own. But the second most important thing that we have discovered in a lab is why those Coley's bacterial soups used to work in the first place 100 years ago. We have figured out that these viruses, these pathogens, you can use them to train your immune system, that your immune system now starts acting on its own, identifies that cancer, and can kill it successfully. And we have figured out that not only that it kills your existing cancer, but it can also maintain the protection over a long term. Because most of the times what you hear about people undergoing cancer treatment, cancer relapse, right? So if you have something in your body that is almost like a vaccinated individual, or it is a drug that stays with you as long as you stay healthy and active, wouldn't that be wonderful? So those pathogens, those are able to do that for you, and that's the future of the cancer medicines. So in our lab right now, we are pursuing various means of what we call the personalized medicine or precision medicine, wherein you use these viruses to train your immune system so that you can kill whatever cancer cells that are there, or you can establish the protection so that you don't get that cancer in the future, so that there is no relapse. Or the future, the dream is that we actually develop the new immunotherapies so that we stop these cancers from developing in the first place. So hopefully next time when your nose is runny, maybe say to your thanks to these uninvited pathogens. Thank you.